Hello everyone, my name is Bernice, and in this video we're going to learn about kidney anatomy and the kidney function while drawing a kidney using Procreate. As you can see, I'll be using a reference from a kidney drawing that I previously made. To the left of the screen, you will see the brushes that I'm using and the structure that is being colored. All of the brushes that I'll be using are Procreate original brushes, and all the coloring will be made in only one layer. We will go over kidney anatomy, kidney function, tests for kidney function, acute versus chronic kidney disease, causes, and treatments for kidney disease. I hope that you will like, share, and subscribe to my channel. For the drawing, I will be using 3 brushes: the HB pencil for sketching, the peppermint pencil, I really like shading with the peppermint pencil, and the gloaming brush. I just recently started using the gloaming brush, and I really like the way that it works for my drawings. Because of how smooth it is, it's easy for me to work with, and I can do all of my coloring in one layer, so I don't have to hop around and layer to layer, and it just makes it easier for me and much more enjoyable. The kidneys are shaped just like a kidney bean. They are located on either side of the spinal column in the posterior abdominal cavity, and each kidney is about the size of a closed fist. Most people are born with 2 kidneys. However, there are instances when people are born with only 1 kidney. This condition is called kidney agenesis, and you can live a normal life with only 1 kidney. The renal capsule is a membranous sheath that covers the outer surface of the kidney. The renal cortex is that outermost tissue layer of the kidney. The renal medulla is that middle layer, which is composed of renal pyramids, and in between each of the renal pyramids are renal columns. The nephrons are the functional unit of the kidney. They are located in the renal cortex and part of the renal medulla. Each kidney has about 1 million nephrons. Their intricate function will need to be covered in another video. Located on top of each kidney is the adrenal gland, which produces hormones that help regulate metabolism and immune system. They also produce adrenaline. That renal pelvis is that upper part of the ureter, and the ureter collects the urine produced by the kidneys. The urine drains down the ureter into the bladder to be drained out through the urethra. The kidneys are working 24/7. They filter about 50 gallons of blood per day. That's about 180 liters of blood per day. They filter waste products in the blood, so the blood goes in through the renal artery. It makes it into the nephrons where it gets filtered. Clean blood is returned back to the body through the renal vein. Waste products and water are excreted as urine via the ureter. The kidneys maintain fluid volume balance by controlling sodium and water balance. Electrolyte balance is another key role of the kidneys. They help with potassium excretion and balance of calcium levels. The kidneys stimulate red blood cell production by producing a hormone called erythropoietin, which tells stem cells in the bone marrow to increase production of red blood cells. The kidneys also regulate blood pressure by responding to a detected low fluid volume. They will activate vitamin D to secrete a hormone called renin, and so then in return, renin will increase the blood pressure. The adrenal medulla produces epinephrine, which is another name for adrenaline, a body's response to stress, or you may have heard of the fight or flight response. The heart beats faster than normal, and blood is pushed to the muscles and to the heart and to other vital organs. There are tests to measure kidney function, one of which is a creatinine blood test. So creatinine is a waste product from normal turnover of breakdown of muscles. So the muscle cells go through a cycle where new cells are formed, old muscle cells die, and as these cells die, they release creatine into the bloodstream. The kidneys will filter out that creatine and then excrete it into the urine, and a normal creatine level is about 0.3 to 1.7. The blood urea nitrogen, otherwise known as BUN test, is a test that measures how much urea is in the blood. Urea is left over from the breakdown of proteins, and a normal BUN is about 7 to 18. The glomerulus filtration rate, or GFR, measures how well blood is being filtered by the kidneys. A normal value is about 90 to 120. Chronic kidney disease may be below 90, and then irreversible kidney damage may happen below 60. And anything below 15 may indicate end-stage renal disease. A kidney biopsy will be needed to confirm diagnosis. Acute renal failure is the sudden loss of the kidney's ability to function properly. Some of the causes include vasoconstriction, any compromise to blood flow, hemorrhage, or hypotension. Intrarenal refers to damage to the nephrons. Some of the causes include toxins and lack of oxygen to tissues. Postrenal acute kidney injury can be due to a urinary tract obstruction, such as kidney stones. The treatments include maintaining blood fluid volume, hemodialysis, removal of the obstruction, or fixing the underlying issue while supporting the kidney. Chronic renal failure is the loss of kidney function over time. This can be due to systemic diseases like diabetes and hypertension. Diabetes is the most common cause of kidney disease. So this happens when excess glucose in the bloodstream begins to stick to proteins. This affects blood vessels, making them more narrow and more stiff, causing an issue with pressure in the glomerulus, causing the glomerulus to expand in size. Hypertension is the second most common cause of kidney disease. This happens when the walls of the arteries that are supplying blood to the kidneys begin to thicken in order to withstand the high blood pressure, causing the arteries to narrow, which results in less blood oxygen, causing ischemic injury to the kidney and the glomerulus inside the nephron. Some of the signs and symptoms of kidney disease may include extreme tiredness or fatigue, shortness of breath, nausea and vomiting, swelling or edema, changes in urine production, cramps or muscle spasms, dry or itchy skin, poor appetite, or the food may taste metallic. Other causes of kidney disease may include lupus, rheumatoid arthritis, glomerulonephritis, HIV, and the long-term use of NSAIDs. Treatment for kidney disease may include diet control and fluid restriction, medications for underlying illness, electrolyte modifiers, ACE inhibitors for hypertension or high blood pressure, insulin for diabetes, and dialysis. There are treatments for end-stage renal disease, dialysis or transplant. So a transplant donor may be a live donor or a deceased donor. And there are different modalities to dialysis. Hemodialysis is a type of dialysis that is usually done at a clinic 3 times a week, and it lasts for about 3 to 4 hours. And the access for hemodialysis includes a central venous catheter, or CVC, which is a catheter that goes into a large vein, an AV fistula, which is the joining of an artery and a vein, a graft, which is an access that is made by using a piece of soft tube to join an artery and a vein. Home hemodialysis is a different type of dialysis or modality. This includes the patient being trained to do their own dialysis at home 5 times a week for about 3 to 4 hours per session. Peritoneal dialysis is another modality that is also done at home. Usually this dialysis lasts about 8 to 9 hours, and usually it is done while the patient is sleeping, although it can be done during the day. And the access for peritoneal dialysis is a catheter that goes into the abdominal cavity, and peritoneal dialysis does not deal directly with blood, which is why there are no needles involved. And so the way that this works is that sugar water is placed inside the abdominal cavity. It is left there for a period of time, probably about an hour and a half to 2. And during that time, this water is pulling waste products and excess water by osmosis, and then this water is drained out. Thank you for watching this video. I hope that you enjoyed it. Please like, share, and subscribe.